Have you ever wondered how to wash someone's hair in bed when they can't get up? It's not just about hygiene, it's about comfort, dignity, and care. In health and social care, maintaining personal hygiene for those with limited mobility is essential. Washing hair in bed helps patients feel refreshed, reduces infection risk, and improves overall well-being. But it needs to be done carefully, with safety and respect. Step 1. Prepare the washing area. Use a waterproof sheet or disposable pad under the person's head and shoulders. Make sure the room is warm and private, and explain each step before you begin. Communication helps the person feel safe and respected. Step 2. Positioning. Raise the bed to a comfortable working height. Support the head and neck with a towel roll or small cushion. If you have a hair washing tray or an inflatable basin, place it under the head so water can drain easily. Step 3. Washing process. Use warm water, not hot, and a gentle shampoo suitable for sensitive skin. Pour water slowly, avoiding the face and ears. Gently massage the scalp using your fingertips, then rinse thoroughly. Step 4. Drying and comfort. Pat the hair dry with a soft towel. If possible, use a low-heat hairdryer to finish. Always check that the person is warm and comfortable afterwards. By following these steps, a caregiver can wash the person they are caring for with comfort and confidence. However, here are some common mistakes to avoid. Forgetting to protect the bed or clothing, using water that's too hot or cold, not explaining what you're doing can cause anxiety, leaving the scalp damp, which may lead to discomfort or infection. Washing hair in bed is a simple act that can make a huge difference in someone's day. It promotes dignity, comfort, and trust, 3 things every caregiver should prioritize. If you want to know more, visit our website.